If we talk about digital access and healthcare infrastructure, the last 2 years of the pandemic have laid bare the inadequacies of healthcare infrastructure in our country and also brought about many innovative solutions which have helped India meet the challenge of COVID. And I would say, when we compare with peers across the world, even the developed part of the world, I think India has done rather well, except that time during the second wave when healthcare facilities across the country got overwhelmed. So, what are the learnings from this? What can we take away as the positives? What are the gaps in healthcare delivery systems which need to be plugged, which need to be done very quickly, others which perforce will take time? So we have to actually focus on the present while at the same time keeping the long-term perspective in view. And that's where, if we talk of infrastructure, most of the healthcare infrastructure in the private sector, and we do know that the private sector, is responsible for nearly 70% of healthcare delivery in India. Most of this is in the metros, the large cities, and the tier 2, tier 3 towns are lacking in quality. Then, when we come to the rural areas, well, unfortunately, they are quite deprived of healthcare facilities, what to talk of quality healthcare facilities. And this is where actually, one would have to look at, especially when we talk in terms of primary care, we talk in terms of preventive care. The public sector, the government, is what would have to actually concentrate on these areas. The basic skeleton of the delivery system in the rural areas, in the far-flung areas, is in place, but is dysfunctional. Be it the PHCs, the sub-centers, the CHCs, even the district hospitals. They have been planned, but they are not working as they should. And what can be done to actually galvanize them to serve the community in these areas so that each and every one of them doesn't need to rush to the higher centers, the tertiary and the quaternary care centers. The one area where the private sector has shown that it can do a great job is in tertiary and quaternary care, especially the organized healthcare sector. But let's not forget that this is very, very small. Majority of the private healthcare is still the clinics, the small nursing homes, 4 beds, 6 beds, 20 beds, the nursing homes where a husband is the surgeon and the wife a gynecologist, or the husband is a physician and the wife a gynecologist, and they are together making ends meet and doing well, providing service. However, the problem has been that while the tertiary and the quaternary care centers may provide high quality care comparable to the best in the world, the same cannot be said about these smaller places, about where there is quite a bit of inconsistency in quality. And that's something we need to confront. That is something we have already recognized. And that's something where probably the Quality Council of India, the National Accreditation Board for hospitals would need to think of ways and means to actually bring the all healthcare delivery systems, small or large, at least up to an average level, below which they would not fall. The other problem has been of access. Why should someone with nothing major have to come from his village all the way to a Delhi or a Mumbai or Chennai or Hyderabad or a Kolkata to get treated? So this is the problem of access. We have not been able to provide access in these smaller tier 2, tier 3 towns in the rural areas, despite several schemes of the government over the years having attempted to do that, trying to incentivize healthcare providers to go to these regions. And the healthcare providers also have attempted the hub and spoke model, but really in a large organized way, it hasn't happened. And of course, one of the reasons could be viability of these projects, financial viability, lack of skilled manpower. Very few specialists want to go to tier 2, tier 3 towns unless they are really incentivized to do this. And unless they also have the facilities there which they've gotten used to. That's an area where probably the government needs to step in with newer thinking so that viable projects can be brought in. When the Ayushman Bharat came, the healthcare industry was very happy. But when the rates of healthcare delivery came, that's when that enthusiasm got completely dampened because private healthcare sector could not see viability in those rates. Of course, those rates are attempting to be revived, to be renewed, to be revised, and we hope, because as it is in healthcare, it is patient capital that invests. It takes anywhere from 7 to 10 years to get money back and to look at profits. And if on paper we are not even able to show viability, then why would anyone invest in the healthcare delivery systems? So that's something which needs to be addressed and needs to be looked at very, very closely. Now, the problem of access was solved during the pandemic when actually patients could not travel. They had to go to local centers or telemedicine, telehealth became the buzzword, where using the telephone, using WhatsApp, using Zoom, different kinds of systems, healthcare was provided, and at times healthcare provided at home to seriously sick patients, especially during the second wave when hospital beds were just not available. So if telemedicine could help patients and could treat patients who were seriously sick during the second wave, there is no doubt that in the months and years to come, this will definitely play a major, major role in healthcare delivery, where from the luxury of your own homes, even in metros, what to speak of tier 2, tier 3 cities and rural areas, you pick up a phone and you can get advice. And there are many new startups which have ventured into this field, and they will continue to come, continue to grow, and somehow need to be welded into the hospital systems, into the diagnostic space with specialists. The family physician who used to be available earlier has more or less disappeared. And personally, I feel that that family physician can be provided through telemedicine, so that and around the world it has been shown that 70 to 80% of day-to-day healthcare problems can be solved on the phone, and it's only about 20-25% of people who need to be escalated up from the GP or the family physician to a specialist, depending on the kind of disease they have. So this is also something which was recognized by the government, and the Telemedicine Act was put into place in March, April of 2020, making telehealth and telemedicine delivery legal in this country. And that, I think, I must congratulate the government. It was a great step done very, very quickly. Also, the government, with its digital health mission, is already thinking on these lines, is thinking of the unique health identity, thinking of electronic health records, which can be accessed from any healthcare facility where a patient goes. And these can be a repository of data which can be used. Actually, something where our country has lagged behind is depending on data to actually devise policy to determine the way ahead and treatment protocols. And with the electronic health records, with the unique health identity, I think it would be possible, with having the data together and being able to learn from it. And the future, they say data is the new oil, and healthcare data definitely will galvanize, will modify the treatment protocols of the future, helped at the back end by artificial intelligence platforms. And we've developed one such, and there are several others that will be developed in the coming future. And artificial intelligence algorithms taken together will be also able to bridge the gap that exists for skilled manpower, skilled doctors, skilled specialists, which will still take us a few decades to be able to reach the level that is actually necessary for healthcare delivery in our country. So we also need to focus. We have an aging population with the health expectancy increasing. And there again, senior care, home care, these are also two new areas which have come into their own in the times of the pandemic and have been galvanized. And along with telemedicine, I think these will provide the digital infrastructure which can be used to lessen the burden on the hospital system where physically a patient would need to go. So the future, I think, is a mix of both the remote access, telemedicine, and brick and mortar infrastructure backed by a digital connect, so that there is data that's available and all decisions taken for maybe asking for diagnostic tests or the kind of treatment to be given are based on evidence, which has been obtained from data sifting. And so this would usher in an era of evidence-based medicine, and also preventive medicine through the health and wellness centers. 1.5 lakh of them would also get a fillip, so that the problems to come are diagnosed as early as possible. We have, of course, we are going through the pandemic, which is an infectious disease, but the non-infectious load in our population is tremendous, be it heart disease, diabetes, hypertension, renal disease, cancer. And so we cannot lose sight of that, having put our focus on the pandemic for the last 2 years. These are patients who have suffered. These are patients whose condition has deteriorated because they could not access the healthcare facilities because of the pandemic. And so in the future, this mix of telehealth, teleconsults, telemedicine, brick and mortar hospitals, diagnostics, uh, 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 district hospitals, medical colleges, all has to be brought together as one whole, and the public and the private sector need to work hand in hand. They need to stand shoulder to shoulder to be able to shoulder the burden of disease. We should look more at creating a disease-free society. Our focus should be on preventive health, primary health, wellness, and of course, those who require treatment should get treated both at the public and the private sector hospitals, which I'm sure in the future will continue to grow based on the incentives that are brought in by the government. Thank you very much.
For more updates from CXO TV, please like and subscribe to our channel.